I understand the concept very well about health insurance because I haven't had very high health insurance bills, and my bills have gone way up in the last 5 or so years. So I don't know what's going on with that, but they seem very, very expensive. And I'm always complaining to anyone who listens that my health insurance costs are really high. So that makes sense that if there are more sick people, the health insurance company has to spend more money on them, and then they got to raise the rates for everyone else. So I understand why sick people is a tax on, and so if you eat a food, smoke cigarettes, or eat animal products, and that causes worse health, that'll raise your health insurance costs. That's very easy to understand. But can you explain how exactly it affects me? Other externalities, so the health insurance makes sense. What else specifically translates that I end up having to pay more money for from people eating animal products?
Well, first of all, I mean, I mean, I don't pay health insurance, but basically, all the prices go up. I mean, health insurance we all pay for because companies have to pay, for their employees, and so they just drive the prices up higher for everyone. So, all these costs come back to us. We pay for them through the higher prices of products, as well as, of course, of health insurance. But I think, there's the prices not only of products, but the prices of what we're doing to the planet. I think those are, the fact that we have such inexpensive meat products, dairy products, and eggs, it allows us to be devastating forests and rainforests and oceans. And when that's happening, we have just a lot more natural disasters. For example, we have soil erosion, we have deforestation, we have flooding, we have droughts, we have just more natural disasters are linked to animal agriculture as well. And so I think we have more conflicts. Animal agriculture essentially is, as I said in one of my lectures, is trauma. I mean, essentially you're paying workers to do horrible things, to stab animals all day, to rape animals all day, to steal their babies. They go back into their communities. They're violent, they're abusive, they're traumatized. They have what psychologists refer to as perpetrator-induced traumatic stress disorder. And so they do terrible things in their communities, and those people are traumatized, and they commit more crimes, and that costs all of us more money. If you're just trying to look at the money, I mean, there's more to cost than just what's quantifiable as money. But this whole web of violence, we have more war in the world because we're feeding most of the grain that could feed hungry people, we're feeding it to animals. And so now we have to have a huge weapons industry because we have conflicts breaking out everywhere. And the driving force behind war is inequity, is injustice, and eating meat is unjust. It's basically some people who have more, and I don't think we should use the word developing countries. That acts like we're developed and they're non-developed, like we're superior to them. They're not undeveloped, they're not developing, they're non-industrial, maybe they're less industrialized, maybe they're less toxic and polluted, or maybe they're more toxic and polluted because we basically externalize our costs onto them. We do the mining in less industrialized nations, and we call them undeveloped, like we're the superior, entitled ones in our developed nations to use, and we're trying to help. We're giving them money so they can become like us, like we're the big brothers. But actually, these are industries and financial institutions that are based on nothing but exploitation and domination and oppression and destroying ecosystems and people's lives and making a lot of money on it, and basically allowing large-scale pharmaceutical industries to come in after we sicken the people with meat, dairy products, and eggs, and selling them drugs, and making them enslaved to all of that. So the cost of this are inconceivable. I mean, when you think about living on a planet that's abundant and beautiful, where people are healthy and free, where we're not being lied to by the media, and we're in a situation where we're at each other's throats competing, and we have these gigantic box chain stores and junk food stores that our poor children are being drugged, and they're being targeted by these corporations, foods that are highly toxic. I mean, how do you put a price tag on their happiness, on their sanity? Kids being driven into suicide, how do you put a price on that? And where women are being targeted sexually and being oppressed. This is all based on animal agriculture. When you have a mentality of domination and oppression of female animals, of raping them by the millions and stealing their babies, and it's just as bad on small farms. It's no better. There's no difference. It's still owning and raping and killing animals. And you go into slaughterhouses, small-scale slaughterhouses are just as cruel or crueler than large-scale slaughterhouses. Factory farming is no worse than small-scale farming. I mean, it's big, it's huge, it's devastating, but when you have small-scale, you have people doing the same horrible things to animals, and you have devastating environmental effects as well. So I think the answers are quite clear when we look at the eternal truths that underlying true abundance, which is available to us on this earth, is living in harmony with nature and with each other and with the other life forms. That's, we can do that. And the cost that we create, that we experience, really, I think we don't realize the price we're paying. We are paying a price that we're so oppressed, we don't realize it. We don't realize how heavy it is to be living in a culture that's acting like this, and how heavy it is on our children to have to be born into a world like this, where already they're targeted. This is huge. How can we say, $400 billion, that's a lot, but that's just skimming the surface of what it really costs us. And I think we have to wake up and realize that we're being exploited, by this whole system, essentially.
Sometimes he just riffs. It's amazing.
How he really feels.
I'll offer a couple of observations as well. I agree with what Will said earlier, and that is that it's difficult to, even though there's a number like $400 billion, we don't really know what the real costs are. That's a number that an economist would say meets the requirements of classical economics. But the number could be 5 trillion, it could be 0, or there might not even be a number, because how do you value somebody's life? But I do think that sometimes having an objective number can be useful, because at least it helps us to put something in perspective. If we know that one number is $10 and one number is $400 billion, then at least we know that there's a difference in magnitude. And one of the calculations that I do is the healthcare costs associated with animal consumption, consuming animal foods. I find that that's a little over $300 billion. And back to Steve's question about how that affects our insurance, there are lots of different kinds of insurance in this country. There are private insurance carriers like Blue Cross, Blue Shield, some of you may have, Aetna. There's Medicare, there's Medicaid. There are alternatives to Medicare like Medicare Advantage. You may or may not know this, but if you pay taxes in this country and or pay insurance premiums, you are subsidizing people across a wide range of health and age demographics. So I have, from my paycheck, deducted payments for Medicaid and Medicare, as many of you do if you get a paycheck or if you pay taxes. So I'm paying to provide health care to people much older than I am, and in some cases that's Medicare, and in some cases to people who are in different socioeconomic groups from I am, from me, and that's Medicaid. I also pay an insurance premium, and I don't even know what that is. Let's say it's $600 a month. But like Will, I don't go to the doctor very often, so I'm also paying to subsidize people who are less healthy than I am. So we are paying to subsidize people in various different demographics. Some of it I think is appropriate. And so, for example, Medicare it's an important social institution. It's been around for a long time. I hope it's there when I'm old enough to take advantage of it. And I hope that there are people getting taxes deducted from their wages to pay for me. Some of it we might think is inappropriate. And Steve's concern is genuine, that if you're healthy and, for example, you don't smoke, you don't eat animal products, you exercise regularly, is it appropriate for you to pay an insurance premium that is essentially subsidizing somebody else who has terrible dietary and exercise habits? Arguably no, but at this point, that's the way insurance works in this country. There's no discount for being on a plant-based diet, although arguably there should be.
One quick little point too, thanks, is you're probably aware of Kaiser, Permanente in California, and how in March of 2013 they finally came out with this long study that they did that took really quite a few years, and they looked in depth at food and what they're feeding their patients in the many and Kaiser's gigantic. It's the largest what's they call it, HMO in the country. They have thousands, I think 10 or 20 something thousand doctors and tens of thousands of nurses and so forth. Anyway, they in this report, which is fascinating to read, I really recommend if you have a chance to just Google that and read it. The bottom line, the statement is that Kaiser recommends, it doesn't recommend, Kaiser mandates that all physicians, all nurses, all health practitioners within the Kaiser system, which is enormous, for all maladies, for all diseases, for all problems that people are having, a whole foods plant-based diet has to be absolutely recommended for everything. It has to be a whole foods plant-based diet. And to me, this is really showing the difference in the way we do healthcare. For example, the typical for-profit hospitals, when someone comes in with cancer, it's like, oh wow, here we got 500,000 right here, And someone comes in with heart disease, well, this will be at least $350,000 or $400,000 or whatever it is. This is how they make their money. And John McDougall talks about this when he was an MD in Hawaii in Honolulu, and he started to make the connections between how people's diet and their health were connected, and he started to actually recommend to his patients that they eat less meat, that he was called before his supervisor at the hospital, and he said, what are you doing? And he said, well, it's great. I found out that when my patients eat less meat, I don't have to do the operations. I mean, they get healthy. I don't have to give the drugs. It just heals them. And he said, you do that anymore, and you're out of here. That's absolutely not an option. You do not do that. And he was really shaken up by that, and so he went on, of course, to create his own clinic. But this is what's going on. This is the basic model. We have to be obvious. This is very obvious. That, this whole system is huge, and the financial institutions in the background have made the loans to build this massive infrastructure of hospitals and cancer centers and all this stuff. There's a huge amount of money invested in all of this, invested in gigantic pharmaceutical industries. The big banks in the background demand a reliable flood of sick people to pay everything off and keep everything going. That's what has to happen. And so the way forward, obviously, is again for us to wake up and say, well, I'm not going to be part of that vast, reliable flood of sick people. That's just basically going into the jaws of an unending killing machine, basically, of corruption and violence and destruction, and live in another way. Live in a way that is respectful of our own systems, of animals, of future generations, and of ecosystems, because we can do that. We can actually question all of the advertising. We're just bombarded with ads, with messages coming from our doctors and coming from the media, from the government, from the FDA, from everywhere, really. And that's why I love this. It's about us empowering each other on the grassroots level, just asking these questions and making the connections. And to me, it's enormously positive to see this kind of a movement growing in our society. It's fantastic.
I'll just add my 2 cents about plant-based diets. There's no question that fruits and vegetables, legumes, whole grains are the healthiest thing that we can eat. All Americans need to eat more of them, and need to eat less meat from a health point of view. And then that relates to all the external costs we've been talking about. But it's important to make the distinction. You can actually eat plants and also eat very unhealthy. So I think it's just important to distinguish between processed and unprocessed. So you could be you'd be a vegetarian, have a plant-based diet, eat lots of white pasta and bread and sweets, and those would all be plant-based, but very, very unhealthy. The two, I think, as far as health costs and the externalities associated with our diet related to health costs are huge. I mean, insurance premiums have gone up to 200% since 1999, and about 80% of all of our healthcare spending comes from chronic diseases that are related to lifestyle choices. And the biggest lifestyle choice component of that is our diet. So the two biggest components of our diet that I think are causing that are sugar and refined grains. And you can make an argument that processed meat is probably really high up there as well. So, but I think it's just important to, when we talk about plant-based diets, I'm sure you're not referring to Pop-Tarts, right, and white pasta. It's talking about the more unprocessed, nourishing stuff that comes from the earth without too much distortion and tinkering by the food industry.